It's a pleasure to introduce our distinguished speaker, Dr. Noor Al-Khori. Dr. Noor graduated from Well Cornell Medical College in Qatar in 2010. She completed her residency in radiology at New York Presbyterian Hospital, Well Cornell Medicine in New York City, followed by fellowship in breast imaging, also at NYPH. She then pursued a pediatric radiology fellowship at Stanford Children's Hospital in Stanford, California. She currently works as a radiologist specialized in women's and children's imaging at Sidra Medicine in Qatar. Dr. Khoury has a Master of Science in Health Economics and Policy from the London School of Economics and a Master of Arts in Public Policy from the University of Chicago. Her interests include quality and safety and being an advocate for the health of women and children. Noor today will be talking to us about policies and guidelines with bending consequences. Welcome, Noor.
Thank you for the introduction. Today we'll be discussing policies and procedures in healthcare, specifically how to leverage them and using a healthcare perspective. So in terms of objectives, basically we want to understand the general purpose and importance of policies and procedures. We also want to talk a little bit about the role of healthcare professionals as stewards of both clinical and administrative procedures, as well as maybe go over some tips and tricks on how to manage policy violations. So important to note that in an organization, you have many resources and many different documents and channels that are used to establish or basically affirm an organization's work culture. So for example, code of conduct is basically talking about the ethics of the organization. Bylaws are usually, it's usually a fixed set of rules. The operating manual assigns roles and duties. Corporate policies are very extensive. They can span many areas from HR to IT, legal, purchasing, etc. Can even have emergency procedures included there. We have different policy committees. We have clinical guidelines. In my organization, we also have DATIX, which is a risk reporting system that you can put in different risks that happen on quality and safety. And we also have a whistleblower channel or a website and sometimes a hotline as well. So just to be aware that different organizations have many different channels in terms of policies and codes of conduct, etc. So the value of policies and procedures are basically to reflect usually they reflect the vision, mission, and the organizational culture. We know many studies have shown that healthy workplace culture leads to better outcomes for patient care. And this is really why we want to have policies and procedures, and we want to protect them and as much as possible follow them. Because also another reason is they mitigate risks. And we know that healthcare environments are extremely complex. We're required to comply with external as well as internal regulations. And we have the responsibility for patient lives. So at the end of the day, we have a lot of responsibilities. We want to, as much as possible, standardize the healthcare that we give, but also standardize policies just to avoid variation, because that is not a good thing. In terms of policies, so usually policies have to be accessible easily by most employees or all the employees. They should be clear and unambiguous, because not only because we want to effectively communicate the goal of the policy and to guide people, but also to avoid litigation. So when a policy is vague or unclear, that's a risk, a legal risk for the institution. We want to make sure policies are in line with wider regulations. So for example, administrative policies have to be in line with bylaws of the organization. They have to be in line with the code of conduct. There has to be a match between all of them within an organization, as well as they have to be in line with external national standards and regulations as well. They have to be dated. Again, this is, it's just for legal purposes. We want to make sure every policy has a certain date. They must be updated regularly. Exceptions to policies. So really, we don't want to have like a very extreme rigid set of policies, because sometimes we'll need to adapt them. Sometimes we'll need to have exceptions. And, in the cases of emergency, for example. So it's nice to have, the ability to have exceptions, right? However, Exceptions to the policy must be defined, and the process of having an exception should be clearly defined and described, just to avoid issues in the future. Usually exceptions to policies are monitored. So in my institution, at least, it's the job of internal auditing to kind of go through, look at all the exceptions to policies and make sure they all followed the process. Policy committees are also there to check exceptions. And I just want to, kind of mention this. So as a leader, we do have the power to misuse policy. So, I could, for example, if I wanted to use policy as a weapon, I could use it against a person and kind of not apply it to another person. And in this case, that would be considered an abuse of power. And I would just want to warn you not to do that. Don't misuse policy, because that is not the point. The point of policies is to be fair and to, allow everybody a fair chance, and you shouldn't really use it against somebody, because that would be like a corporate bullying scenario, which is not something good for you. Brings me to my next point, which is we as healthcare professionals should really be stewards of policy. So we have to be very careful and manage policies very well. I think of stewards as sort of shepherds. We want to guide the sheep or guide the animals, but also take care of them, right? So, and part of part of our responsibility is protecting policies and make sure that they get enforced, because that's part of our ethics. It's part of our organizational culture, and we really have to maintain that, because that's how we basically preserve our culture, a healthy workplace environment. We have to be aware of policies because we want to do things right. We want to do the right things. We want to recognize wrong behavior. So if we don't know the policy, then we will never see the problem. And we also need to know what to do when we see wrong behaviors, and also to protect myself. I need to be aware of policies, because sometimes, unfortunately, bullying is very common in healthcare. And, one strategy is to really be aware of policy and your rights as an employee. In terms of managing policy violations, so, I have here some strategies. So at least things that worked for me. So you try to understand why. So sometimes it's just a matter of the staff are unaware of the policy, right? Because sometimes we have so many policies and they're just really hard to keep track of. And sometimes there just is like an ignorance of what really is the policy. So staff may actually need to be trained or educated. And this can happen with your subordinates, and it can also happen with your bosses. So just try to understand why. And if there is a need for education, then you should be the one to kind of lead in this area, educate people about policy or organize the appropriate training. In the case where you don't know what to do, why it happened, or whether you're not sure what to do, you can report it to the appropriate channel. So I mentioned in the very beginning, there are many, many different channels, and you really need to be smart and knowing, what sort of things to report where. So if it's an HR issue, it should go to HR. If it's, maybe an admin issue that should stay in your department, that maybe should stay with your chair, for example. If it's a quality and safety issue, maybe that needs to go to Datix. So you kind of need to be smart and not to use the incorrect channel. You always ask for clarification sometimes. If the policy is unclear, then you want to push for clarification and for revision. Remember that policies are meant to be revised. They're not fixed. They're not like the bylaws. We're supposed to be updating them, revising them regularly. That's good practice. And this actually, I've had situations where I actually led to policy being revised and clarified. Escalate if necessary. So, that's pretty straightforward. And you also have the whistleblower channel if you want to remain anonymous. So basically, the take-home message of this talk is know the rules. The rules can help you. It can help you manage people. It can help you manage yourself, and it can have a lot of benefits. And if you have any questions, feel free to email me. My email is below. But thank you very much, and good luck.